Welcome back on this Friday night. The CDC says twice as many healthcare workers reported being harassed by patients in 2022 than in the previous survey.
Those workers who reported being harassed were more likely to have mental health issues than workers who weren't. Elizabeth Shores tells us what Sanford Health is doing to keep workers safe.
A lot of nurses have to get up close and personal with a patient as part of their job. Sometimes, though, patients react aggressively. The director of the North Dakota Nurses Association says harassment toward nurses is particularly common since nurses are around patients 24/7.
I personally have experienced it many years ago in my career, and that was just even being chased around a nurse's station that was kind of in a circular in the hallway after a 12-hour shift, which was more like a 15-hour shift after everything was said and done, and exhausted beyond belief and just being chased. And that, well, I'll never forget that because it was just a scary situation.
Some of the harassment in the CDC's report included receiving threats, bullying, and verbal abuse. Sanford's Director of Safety and Security, Brad Erickson, says while the majority of the harassment against workers comes in the form of verbal abuse, sexual harassment toward nurses happens as well.
We are seeing it here in Bismarck-Mandan, and it's been on a steady increase for, I would say, the last decade.
He says Sanford recently implemented a behavioral response team healthcare workers can call on to help them de-escalate a situation, in addition to basic de-escalation training available to all Sanford staff. Other steps like calling in security or writing up a behavioral contract can be utilized as well.
The Assault Against Healthcare Workers bill did not pass in the North Dakota legislature earlier this year. It was one vote short.
So close.